Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Antibiotic resistance rising fast. WHO warns. Breaking number 148. Dangerous infections that no longer respond to antibiotics are spreading quickly around the world, increasing by as much as 15% a year, according to a new report from the World Health Organization, WHO. The report found that 1 in 6 infections worldwide in 2023 was resistant to common antibiotics, including drugs used to treat urinary tract infections, gonorrhea and E. coli. These antibiotic-resistant infections, known as antimicrobial resistance, AMR, kill more than 1 million people a year and contribute to the deaths of nearly 5 million others. And number 156, antibiotic resistance is widespread and threatening the future of modern medicine, and number 157, Dr. Ivan Udan, director of WHO's Department of Antimicrobial Resistance, told the New York Times. And number 156, simply put, the less people have access to quality care, the more they're likely to suffer from drug-resistant infection. And number 157. The problem is especially severe in Southeast Asia and the Eastern Mediterranean, where 1 in 3 infections are now resistant to antibiotics. And number 148, roughly double the global average and more than 3 times higher than rates in Europe or the Western Pacific. Resistance was also higher in low and middle-income countries, where weaker health systems make it harder to track, prevent and treat infections. The report also highlighted growing resistance in so-called gram-negative bacteria like E. coli and Klebsiella pneumoniae, which can cause serious infections. Gram-negative bacteria are especially challenging because they have a protective cover that can be tough for antibiotics to penetrate. In parts of Africa, resistance to cephalosporins and number 148, a class of antibiotics, and number 148, exceeds 70%, often ruling out first-choice treatment. Without action, experts warn that AMR could cause a $1.7 trillion drop in global economic output by 2050, driven by increased healthcare costs and lost productivity. Greater than a recent study in The Lancet estimated that 39 million people could die less than speak from drug-resistant infections over the next 25 years. There is some hope, however. Since WHO launched its antimicrobial resistance surveillance system in 2015, nearly 140 countries have joined, and 100 of them contributed data to the latest report and number 148, a fourfold increase from previous years. Silvia Bertagnolio, who leads WHO's AMR surveillance programs, said she was encouraged by the growing global awareness about drug-resistant infections and by the increasing number of countries sharing data. But, she added, nearly half of all countries still didn't submit data last year, and many of those that did lack the tools to track resistance accurately. Antibiotics 101. List of common antibiotics and AMP types. Antibiotics and alcohol. Probiotics and antibiotics. Antibiotics for strep throat. Antibiotics for a tooth infection. Antibiotics for UTIs. Sources: The New York Times, October 13, 2025. Disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Copy, 2025 Health Day. All rights reserved. Ad as a preferred source on Google. Read this next. Dear college students, essential tips to avoid getting sick on campus. Number 148, the college experience is a whirlwind of late nights, crowded dorms and shared spaces. And number 148, a perfect storm for germs. Getting sick can get in the syphilis in newborns keeps rising, despite drop in adult STI cases. Break Thursday, September 25, 2025 and number 148, sexually transmitted infections, STIs, declined in U.S. adults last year, but syphilis passed from mothers to newborns continued to climb. New Break drug-resistant nightmare bacteria infections saw 70% in U.S. Break Wednesday, September 24, 2025 and number 148, infections caused by bacteria that no longer respond to many antibiotics are climbing at an alarming pace in the U.S., new federal data. Break more news resources for MedWatch Drug Alerts Daily Med News for health professionals New drug approvals New drug applications Drug shortages Clinical trial results Generic drug approvals Subscribe to our newsletter. Break whatever you're to less than /speak. Speak pick of interest, subscribe to our newsletters to get the best of drugs.com in your inbox, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.